Hi. So you're wanting to talk about where you want to give birth, right?
Correct.
So you know that our options in the area are hospital birth, birth center, and home birth. So what are you thinking right now in regards to birth?
I really want to have a home birth.
You really want to have a home birth, okay?
What's the difference between that and birth center versus hospital?
Okay, so in a hospital, you are going to typically be under an obstetrician care. In a birth center or home birth, you are going to be primarily under a midwife, under the care of a midwife. There are some midwives that work in hospitals as well, and they can be great, but you will strictly be seeing midwives when you're out of the hospital. There are a few states where there are some OBs who work in birth centers and do hospital births, but that's not in this state, so it will be all midwives. And midwives typically provide more individualized care, more time with their clients, and they really get to know you and what your birth wishes are and your goals. So you typically get more of that one-on-one time with your provider than you in a home birth or birth center than you do in a hospital. So the biggest thing about hospital births is you have access to pharmaceutical drugs. So you have access to epidurals and any other type of pain relieving medications that you may need during labor, but you do not have that option when you're at home or the birth center. So, but one thing that home birth and birth centers have is they usually have the option for you to give birth in the water. So most birth centers have tubs where you can labor and deliver in the water, and home birth as well, you have that option. In hospitals, especially in this area, you typically are not allowed to give birth in the water. Most hospitals do not have tubs around here. A few do, but they're not always available, and you're not technically allowed to birth the baby in the water, but you can labor in the water. So that is something to consider when you're looking at your options, is if water birth is important to you, just know that you may not get that. You likely will not get that in a hospital around here.
Everybody talks about the safety of home birth. Is it safer than, or as safe as hospital birth?
So studies have shown that in low risk, uncomplicated pregnancies, that giving birth at home under the care of a midwife or at a birth center is just as safe, if not safer, than giving birth in a hospital. Midwives who work in birth centers or do home births will not take clients who are high risk. So your high risk pregnancies are going to be in a hospital, and they require more medical care and more treatment and more medical care than a low risk uncomplicated pregnancy. So home birth, again, you're focused on low risk, uncomplicated, healthy individuals and healthy pregnancies.
Okay.
So midwives are watching you throughout your pregnancy and making sure that everything is good. If something comes up along the way and you're not able to have that home birth for whatever reason, if some complication arises, then you will be referred over to an obstetrician and getting that higher level of medical care. So midwives out of the hospital will not take on clients who are high risk. Right. So that is a plus.
That makes sense.
And midwives are, I have to talk. Midwives are especially very well trained in neonatal resuscitation, CPR, and can administer IVs and pain medications in case of hemorrhage. So they're very skilled in providing that care, and I know that's a big concern for a lot of people is the safety aspect. Or what do you do if this happens, or XYZ and all that? But midwives are extremely skilled in handling all sorts of situations and birth emergencies. The one thing that the hospital does have is an OR, so if a cesarean was needed, that is available in the hospital. However, for low risk, uncomplicated pregnancies, it's not very common for an emergent situation like that to happen. Like that's very rare. And in some hospitals you can labor and give birth however you want, but you're more likely to have freedom of movement and freedom to birth how you want without interruptions and without interventions if needed when you're out of the hospital. So whether that's birth center or at home. Does that make make sense?
I think so. So it sounds like if you take the correct precautions, everything is safe with the home birth.
Yes, exactly. And some other pluses for, you know, birthing outside of the hospital versus in the hospital are you get to be in your own home, in your own bed, and you don't have, in a hospital, you have people coming in and out to check on you, especially after you have a baby. They come in very regularly to check on you, and it can be very hard to sleep and get rest. And again, some people like that, the safety of having the hospital, and they want to be away from home. It's totally a preference and what you were looking for. But if you're wanting that time for you and your baby to bond and not have that interrupted time and to actually, you know, get some sleep, home birth center might be the option. Some people want to know, like, what's the difference between birth center and home? Like, is there a difference there? Birth center, I like to tell people that a birth center birth is kind of like a home birth, but not at home. So basically the difference is you have the same equipment available, you have midwives with the same skills, you're just leaving your home to go to a birth center, and they typically try to set it up kind of like a little home, like a little birthing suite with a bigger bed and tub and all that, so it looks homey like, but you do have to leave your house still. But then you get to come home and be home. However, if you're home, giving birth at home, you don't have to leave home and everything's there. Midwives come and bring everything to you. And they will clean up and do all that. And typically when they leave, you can't even tell they've been there. So some people are concerned about the messiness of a home birth, or I don't want to mess up my home and get it all dirty and cleaning up and all that. But typically your birth team takes care of all that for you, and you can't even tell that they've been there. So does that kind of answer your questions about that?
I think it does.
Do you have any?
No, I'm looking forward to my home birth.
Great. One last thing, because some people like to know about insurance and when it comes to paying for.
Does insurance cover home birth?
So it depends.
Under insurance.
So in a hospital, pretty much every insurance would be covered for that.
Go ahead.
Go ahead. I'll help you in a minute.
Who will wipe me?
Go ahead. I'll wipe you when I'm done.
Okay.
Out of hospital birth, it will depend on the provider. In Ohio, it can be a little tricky to see who will cover what. If you're paying out of pocket, it's going to be a lot less to pay for an out of hospital birth than it is going to be to pay a hospital birth.
Yeah.
So definitely check with your provider. A lot of midwives can submit their bills and see about reimbursement for you, or they can bill your insurance for you. And some people can submit that themselves and get reimbursement. So definitely talk with your provider about that for sure. But just know that generally speaking, it's going to be cheaper to pay for out of hospital than it is in the hospital. So you just kind of have to look at everything there.
Good.
I think that's pretty much it when it comes to all three options. And since you're pretty much set on home birth, I think you made a good choice here. So I'm going to leave you with some handouts that kind of just summarize what we talked about today. Just birth center, home, and hospital. That way you can just kind of look at everything.
Okay.
And also check out Evidence-Based Birth. It's a website. They have a ton of information about all the questions that you've had. And they present all the research and just give you matter-of-fact information as you're going through this pregnancy and considering birth. So I'll give that to you before you leave today.
Cool, thank you.
Thank you.